Hope is so important. It's important now, particularly because of the COVID virus, but it's really important at all other times in our lives. Hope can get you through difficult situations. Hope can get you through serious illnesses. I equate hope with positivity. A positive attitude actually has been shown to grow an area in the brain, the hippocampus. Now that's the area that shrinks with Alzheimer's disease, the memory and learning center, but it also shrinks with negativity. And it grows with positivity. Now that's just not speculation, that's been shown on MRI. And it doesn't cost anything and there are no side effects. So it's important to be hopeful, it's important to be positive. There's a tribe in the Philippines of natives who have a harvest festival every fall. And what happens the month before? The rate of the elderly women who are the center of the harvest festival, that rate drops to virtually zero. They get honored during the harvest festival, and what happens after? Twice as many deaths. The ones who are going to die anyway, and the ones who put off their death for a month to get to the harvest festival. This has happened year after year after year. It means that what you think can be a life and death situation. Another example is a former next door neighbor. She went to her doctor and got a diagnosis of terminal breast cancer. Her doctor said, "You've only got 6 months to live." Apparently she broke out laughing and said, "Doc, I think you're wrong. My daughter is going to start university in a couple of weeks, and I'm going to stay alive, and she's going to walk across that stage in 4 years, and I'll be there." And she was. And what happened after? She died 2 weeks later. There's a personal example of the strong, strong will and strong hope that can get you through death. Well, think what it can do for everything else in your life. Hope is important. Positivity is important. We always let down. There's a negative person who's yapping at you, and as my wife said, it doesn't matter if they're talking to you or a post. It's the same negative story for you, the next person, the next person. So what does she say to do? Put up an invisible plastic shield, let that negativity bounce off, don't let it get into you, you'll be better off. Sometimes during a day in the office when things aren't going well, I've got to catch myself. And what do? I look at my coffee cup. Positive vibes only. You've got to refocus, be positive. I think that it's easy to default to the negative and be negative. It's harder, it takes more work to be positive, but it's important because of the effect it can have on you and everybody around you. What about New Hope? When Joan and I wrote our book, New Hope for Concussions, TBI, and PTSD 3 years ago, why did we use that title? Well, this was new information. Many of the people I was seeing in my brain clinic and my other clinics had been dashed and told, well, you're just not going to get better. This is your new normal. And how often do we hear that now? Nothing can be done for you. You look fine. That's so judgmental, particularly with a brain injury. And what we usually do is sit down and talk with them and say, I've been in your situation, which I have. I know what it's like. We've got all these other people that we've gotten better, and I start telling stories of other people. They don't care about statistics. They want to hear the stories because some of those people are just like them. What do? They get new hope. And I say getting that hope is the first day of finally getting better. And it's complicated. Medicine is not simple. People want to make it simple, single magic bullet. For example, there's 36 factors in Alzheimer's disease. So someone says, oh, I have a drug for Alzheimer's. Dale Bredesen, who wrote the book, The End of Alzheimer's, says, great, you plug one hole in the roof, there are 35 others leaking. You don't need a single magic bullet, you need magic buckshot. So things are complicated. In our concussion book, we point out that I will treat the hormones which are damaged from a pituitary injury, a blow to the head to your pituitary gland, which makes your hormones, and usually the hormone levels aren't good, which can lead to anxiety, depression, increased risk of stroke, heart attack, diabetes, Alzheimer's disease, all those things. And more recently, an increased risk of getting COVID or succumbing to it. There are others that we need, though. One doctor can't do this alone. And so we've got a group of 3 others, one who does the visual processing, one who does the neuropathic burning pain that people get from the whiplash, the concussion, and another who does audiology, ringing in the ears, noise sensitivity, dizziness, nausea, and balance. And that's our team. And the team can do this superbly. So in New Hope for Concussions, we talk about this, we talk about the team, we talk about how to look after yourself emotionally. That's the chapters that Joan writes. And we're spreading this information. The book is now around the world. It's #1 bestseller on Amazon Canada and the top 15 in the United States. It's been so popular that we're going to rewrite the book, put in more information, and have a second edition, and there soon will be an audiobook. Once again, this is an example of how hope helps, because often the patients have been told, no hope, you won't get better. Well, we're changing that whole model to new hope. And so that shows you the importance of hope generally and positivity. That all is important.